about spleen and how the spleen has a mind of its own. It can get big and get little, and a lot of times it doesn't even mean anything. Okay, moving along, the stomach. I already briefly mentioned the stomach. So in this particular case, the stomach has a moderate amount of ingesta or food in it, a little bit of gas in it too. We talked about in a lateral view, the normal position of the stomach axis. So the stomach axis normally should be somewhere roughly parallel to the ribs to perpendicular to the spine, somewhere in that general area. And the stomach axis is used to judge the size of what organ? And that the answer to that would be the liver. The stomach radiographically has two parts, okay? The biggest part on the lateral views, whether it's a left lateral view or a right lateral view, is the dorsal area up here. That's a little bit bigger, and that's called the fundus, okay? The smaller part down here ventrally on the lateral view is the pylorus, okay? That relation does not change whether it's a right lateral view or a left lateral view. Okay, on the VD view, here's the stomach. The bigger part is the fundus. It's over on the left-hand side. And the pylorus is over here on the right-hand side. The pylorus, outflow tract from the pylorus will go into the duodenum, which goes down this way. Okay, so pylorus is to the right, fundus is to the left on the VD view. On the lateral view, pylorus is always ventrally located, and fundus is always dorsally located in a normal dog. Again, the stomach can be variably distended. If you just had a big meal right after Thanksgiving, it's going to be huge. Okay. After you haven't eaten for a while, it's not going to have hardly anything in it, maybe just a little bit of gas, and that's about it. Okay. The small bowel. The small bowel is this red thing. So basically, the small bowel should be randomly situated, randomly oriented areas of mild fluid and gas-filled opacity throughout the entire abdomen. Okay. The couple of rules for the small bowel, though, in a normal animal. The small bowel should be uniform in diameter throughout the abdomen. Whether it has gas in it or fluid in it, the diameter of the small bowel should be all about the same throughout the entire abdomen. So people refer to that, you will have one population of small bowel. The entire small bowel is the same diameter. What you don't want to see is two populations of small bowel. You don't want to see some of the small bowel is very normal in diameter and other portions are 2 or 3 times that diameter. That usually is a sign of something's wrong, most of the time an obstruction. The other thing that you want to see about the small bowel is you have nice random lazy loops. Okay, so it's like if you were holding on to a rope and you just let it dangle down to the ground, it's going to gather on the ground in nice lazy loops. Okay, you do not want to see hairpin turns. Okay, you don't want to see sharp where you would kink the rope. You don't want to see sharp hairpin turns of the small bowel. So random distribution. The entire small bowel is about the same diameter, one population of small bowel and lazy loops. Okay. The other thing is there is a measurement that you can use radiographically to judge the normal diameter of a small bowel. And the easiest way to do that is you look at the lateral view in this area up in here, and you can see here's a vertebral body. Okay, you go to the mid portion of the vertebral body. So from about here to here, and a normal small bowel loop should be less than the height of the lumbar vertebrae. Okay. And you go in the mid vertebrae, not where it's big and wider at the end. So the mid lumbar vertebrae, less than the height of a lumbar vertebral body. Okay. So that's from here to here. The small bowel loops should all be less than that height. You don't want to measure from the ventral aspect of the vertebral body up to the dorsal spinous process. That's cheating. Okay. So you measure just the body itself, which is this rectangular looking part here. So from here to here, the small bowel loop should be less than the height of one vertebral body. Okay, so what's just quick review? What is the small bowel loop? Normal in a normal dog. Nice random distribution with lazy loops, one population of small bowel, all the same diameter, and that diameter should be less than the height of a vertebral body. Okay. Where does the duodenum live? Well, it depends if you're a dog or a cat. Okay, if you're a dog on the VD view, again, here's the fundic region of the stomach. Here's the pyloric, ill-defined area over here. The pylorus gives rise to the duodenum. Okay, as ingesta and gas and fluid leaves the stomach, it goes into the duodenum first. Okay, typically the dogs over here will have a cranial duodenal flexure. They have the descending duodenum. The descending duodenum in a dog lies immediately adjacent, right next to the lateral body wall in all dogs. Okay, so the duodenum comes down in here, and then somewhere down in the mid abdomen, it will kind of go medial and turn into the caudal duodenal flexure. And then that gives rise to the jejunum, which are these small lazy loops that we just described throughout the remainder of the abdomen. Okay. On the lateral view, the pyloric region of the stomach, we said, lives ventrally. So it's down in here, and it gives rise to the descending duodenum. So the duodenum would come up in here on the lateral view, kind of comes this way, which is the cranial duodenal flexure. That corresponds to this part of it on the VD view. So duodenum, cranial duodenal flexure, descending duodenum coming down in here, which would give rise to the caudal duodenal flexure, and then the remainder of the small bowel. Okay, that's where they would live in a dog on the lateral view in this area, the VD view. In a cat, this is the same on the lateral view, but in a cat, typically the descending duodenum lives a little bit more towards midline. So kind of somewhere over this way instead of the lateral most bowel. Okay. Also, when we talk about ultrasound, remember this drawing, because the duodenum with ultrasound, you can typically find in a dog right here. And it's the only section of small bowel that is basically fixed in its location. It doesn't move around the remainder of the abdomen. It's always right here next to the lateral aspect of the abdominal wall, and you can find it. And it's also the only part of the small bowel that will go directly cranial to caudal in a straight line. The rest of it is randomly distributed around the abdomen. Okay, so this is a radiograph of a dog. So we gave contrast material, which is barium solution in this case. And so here's the stomach. Now you can see the side, the inner part of the stomach because we gave contrast. So here's the fundic region of the stomach. All this stuff over in here is the fundic region. This is the pylorus. And this is the cranial duodenal flexure, giving rise to the descending duodenum right along the lateral most aspect of the abdominal wall, the caudal duodenal flexure, and then that gives rise to the jejunum and the remainder of the abdomen. This is contrast in the colon. And then we have these in the fundus, we have these little filling defects along the edges. Okay. And those are normal rugal folds inside the stomach. It's not an abnormality. If the stomach gets fully distended and stretches out, those will kind of smooth out and go away. But filling defects along the edge of the stomach, in a non-distended stomach, those are just typical normal rugal folds. Okay, then we talked about in a dog, the cecum and the colon. We mentioned that the cecum on a lateral view kind of lives right up in here, and it always has gas in it. On the VD view, the cecum kind of lives right in here and is gas filled to the right of midline. The cecum, of course, gives rise to the ascending colon, the transverse colon, and then the descending colon that kind of travels down usually to the left of midline. On the lateral view, we have the cecum here. It gives rise to the ascending colon, which is typically really short. And then right here, right behind the stomach is where the transverse colon lives. And then that gives rise to the descending colon. And again, the cecum in a colon in a dog is usually prominent. Depending on when the dog last defecated, it can be chock full of feces and gas, or if they just defecated, it will be very minimally distended and maybe a little bit hard to find. Okay. And again, the cecum in a cat is a totally different animal. The cecum in a cat will never cause any problem, and you can hardly ever even find it. Okay. Okay, kidneys, where are they located and how do we know if they're too big or too little or whatever? Well, the kidneys on the lateral view should be up here. The kidneys are actually not, if you remember, they're not in the abdominal cavity. They're in the retroperitoneal space. Okay. The right kidney lives right over in here, and it's almost always more cranially oriented than the left kidney. Okay. But the kidneys should be roughly shaped like a kidney bean, and they should be about the same size. And the margins of this should be nice and smooth. They shouldn't be lumpy, bumpy, or flat. Okay. There is also a measurement for kidney size, and it's based on a VD view, but everybody also does it off the lateral view. So in a dog, we compare the length of in a dog and a cat, we compare the length of the kidneys to the length of the body of L2. Okay, so we go in here. So here's the 13th pair of ribs. This the last pair of ribs. That makes this T13, which makes this vertebral body L1, which makes this vertebral body L2. That's the one we use for kidneys, L2. And in a dog, the kidney here, both kidneys in a dog should be somewhere around 2.5 to 4 times the length of L2 in size. Okay. In a cat, it's a little more exact, a little smaller. In a cat, probably somewhere around 2.5 to 3, or maybe 3.5 times the length of L2 in a cat. Okay. So we have a built-in control. And why is that important? That's because if this is a Chihuahua, Chihuahuas are going to have smaller kidneys than if it was a Great Dane. But because we use the vertebral body in each one of them, it changes in size. That relationship stays the same. Okay. And so the length of a kidney in a Chihuahua versus a Great Dane is going to be smaller, but so is L2. Okay. And so it works no matter what size the animal is. If it's a Chihuahua or a Great Dane, that measurement will still work. Okay, same thing. This is just cat kidneys. Okay, the urinary bladder is another one of those organs. Obviously, it is variable in size. If you have to pee really bad, then the bladder is going to be huge and contain a lot of fluid. If you just peed, the bladder will be basically hard to find because it has nothing in it. Give it time, it'll fill back up, right? So that's where the bladder lives. It's extremely variable in size depending on if you need to pee or not. Okay, what about in a male intact dog? Where does the prostate live? Well, the prostate, here's the urinary bladder. In a male dog, remember, here's the os penis. And so we have this big, long extension in male dogs of the pelvic urethra. It kind of comes all through this way and down through the os penis, right? And so in a male dog that's especially intact, the prostate lives at the junction of the neck of the bladder where the urethra comes out. So right in that area is where the prostate will live. Okay. On the VD view, it lives smack dab in the middle of the pelvis, right in here on midline. Okay. If the prostate is small, in other words, if the dog was castrated when he was 3 months of age and has no abnormalities associated with the prostate, you will probably not even be able to find the prostate on radiographs. On the other hand, if it's an intact male, then you can usually see the prostate even by the time they're 6 to 9 months. It starts to get big. If the prostate gets really, really big, what lives right dorsal to the prostate is the colon. And if the prostate gets huge, it can actually compress the colon and lead to the inability to defecate because it compresses the colon. Okay, sometimes also you can see some vessels inside the abdomen, especially in fat dogs. And again, the fat is nice because that provides extra contrast around all these soft tissue opaque organs. So the caudal vena cava in a dog or a cat kind of lives through this area here. And sometimes you'll see a fluid tubular opacity up here in the retroperitoneal space that represents where the caudal vena cava lives. Okay. And of course, the caudal vena cava then extends cranially. And then once it dives through the diaphragm, this is the caudal vena cava and the caudal aspect of the thorax. Okay. Sometimes if you look real closely, there's a little radiopaque dot right there in the retroperitoneal space. And sometimes that can become very small, but very opaque, and where you can really, really see it really easily. And when that happens, I've had people will confuse that for a stone that might be in the ureter that goes from the kidneys down this way into the bladder. Well, that's an artifact if you only see it on the lateral view. It's usually an end-on branch of a vessel that comes off the aorta called the deep circumflex iliac vessels. And they come off transversely to each side from the aorta. And if you see them end on, you'll see that little dot right there in the retroperitoneal space that you don't want to mistake for a ureterolith, a stone in the ureter. Okay, and then we have to worry about, well, like I said to begin with, we have a fair amount of organs in the body, in the abdomen, that we do not see radiographically, but we have to know they're there. Well, we just don't typically see them if they're normal on radiographs. So where are those organs and where do they kind of live? Okay, well, we already talked about this one. The gallbladder typically lives right here on the lateral view. We don't see it because it's silhouetted with the liver, but that's where it lives. Okay, and then we have the pancreas. So the pancreas lives right next to the duodenum. And we just said the duodenum, kind of on the lateral view, lives in this area. So a normal pancreas lives right up in this area in dogs, right next to where the duodenum lives. Okay. If this was a female dog, the ovaries live right here near the kidneys, but just caudal to the kidneys. So we would have a right ovary and a left ovary that lives somewhere up in this direction, just caudal to each kidney. Okay. And then we have adrenal glands. I don't have them on here. I do on the VD view in a minute. But the adrenal glands live right next to the kidneys. So the adrenal glands would live right up in this area, right in here, right near the kidneys. But typically we don't see them on radiographs. And then in the abdomen, we usually have about 2 or 3 clusters of lymph nodes. Okay. And typically, if the dog doesn't have isn't full of parasites, eats a good diet, doesn't have lymphoma, is not a stray dog or things like that, a well cared for dog, you're never going to see typical lymph nodes in a normal abdomen in a dog. But we have to know that where they are because they can become abnormal and really big. So the one group of lymph nodes, the most common one that you're going to see that will cause abnormalities is right here. It's called the sublumbar lymph nodes, and they typically live sublumbar underneath the region of about L6 and L7. Okay, that's where the sublumbar nodes live. And then we have another group that lives here in the mid-abdomen, right near the cecum and just in the mid-abdomen and the mesentery. And these are called mesenteric nodes. Yes, again, normally you won't see them. And then we have another group of abdominal nodes that live just caudal to the stomach called the gastric nodes, but that's where they live. On the VD view, kind of the same thing. So where are these organs living on the VD view? In the VD view, we have the gallbladder that lives to the right of midline. We don't see it. It lives and it's surrounded by liver. Okay. We have the pancreas. This blue thing is where the pancreas lives on a VD view. Again, the duodenum kind of comes out this way. It usually lives caudal to the level of the stomach, and right next to the duodenum is where the pancreas live. This would be the left limb of the pancreas. This is, people call it the body of the pancreas, and then the right limb of the pancreas. Okay, but that's where the pancreas lives. Okay, the adrenal glands. Here's a kidney sitting over here. Here's another kidney sitting over here. The adrenal glands usually live just medial and slightly cranial to the kidneys. So those red ovals would be where adrenal glands would live, but typically we don't see them. The ovaries live just caudal to each kidney. So there's a right ovary. The left ovary would be sitting here, right, just caudal to a kidney. And then we have the lymph nodes. So these would be the gastric nodes, mesenteric nodes, and these are the sublumbar nodes that live on either side of the sublumbar region. Okay. Okay, and then we have to talk about this thing called a mass effect. So when an organ gets big, whether it's due to a benign cyst or cancer in the organ or really big lymph nodes due to lymphoma, then that organ gets bigger and bigger and bigger and bigger and will cause a mass effect. If I go back to this view here and I look at this lymph node, this sublumbar node, and typically, like I said, normally in a well cared for dog, you're not going to even see that lymph node. But if that lymph node starts to get bigger and bigger and bigger around it, it's going to want to push away all of the organs around it away from it. Does that make sense? Now, what do you think is going to be the ability, if this lymph node starts to get big, to push away the vertebrae? The vertebrae is a formidable boundary, is not going to be able to push bone out of the way. That's fixed in its location. It's not going to push bone around. But all this other stuff around it, cranial to it, caudal to it, and mostly ventral to that big lymph node, it can easily push away from it. And so as that lymph node will get bigger and bigger and bigger, it causes what's called a mass effect, which means it gets so big, it pushes the normal organs away from it and pushes them out on every direction that it possibly can. Can't push dorsally because that's bone. It's not going to push on bone. Okay, so that's called a mass effect. And so what we have to know is we have to put in what we just learned. What organs live where? What is their normal shape and size? How do we judge if they're too big or they're too little? And if those organs, even the ones you don't see typically on radiographs, get too big, they're going to cause a mass effect and push stuff around it away from it. Okay, so let's imagine on a lateral view, I have a dog and I have something that is getting too big, a mass that's getting too big that lives up here in the cranial dorsal abdomen. And it gets so big, it starts to push everything else away from it. Okay, then I could ask you, I said, okay, what could the origin of that mass be? What lives in that blue shaded area that if it got too big or abnormal, it could push everything else away from it? So, anatomically, what lives there? What lives in the cranial dorsal abdomen? Well, we said the head of the spleen lives up there. Okay, so that would be could be a splenic mass that's in the head of the spleen that pushes everything else away from it. Okay, we said the fundic region of the stomach lives up there, so it could be something that's in the stomach wall itself, gastric adenocarcinoma or lymphoma that's living in the stomach wall itself that pushes stuff away from it. It could be the kidneys. Okay, the right kidney, especially because it's usually more cranially located, but part of the kidneys, you could have a mass in the kidneys or a big cyst in the kidney that grows and grows and grows. And as it grows, it pushes everything else away from it. Okay, the right adrenal gland, the adrenal glands also live right up in that area. So, especially the right adrenal gland, if it got abnormal and too big, it could cause a mass effect arising from that area. Okay, the right ovary, if it's an intact female dog. And again, a little part of the liver extends up that way too. So that liver, you couldn't rule that out. So any one of these would be fair game that could cause a mass effect in that part of the abdomen. Okay, if you had a mass effect in the abdomen, could it be the urinary bladder that's causing the problem? No, the bladder doesn't live anywhere near there. So it's not going to be the bladder. It's not going to be the prostate. It's not going to be the colon. Okay, but it could be any one of these organs. And so we have to play this same game, which y'all can do and get ready for the next test, of what lives where. And if it became abnormally too big, it's going to cause a mass effect in that area. And what could it be arising from? Okay, so you just have to know your anatomy. So let's cranial ventral abdomen now. If something forms in that area, becomes too big, pushes everything away from it, what lives there? Well, mostly it's going to be the liver in that area. So a hepatic mass is going to be the most common thing that could cause a mass effect in this part of the abdomen. Well, the gallbladder lives there too. So it could be something in the gallbladder. The gallbladder could get huge, could be obstructed. Possibly that could cause a mass effect in that area also. And then the pyloric region of the stomach also lives down there, could possibly cause a mass effect. Probably the most common one would be a hepatic mass or a liver mass. Okay, what about in the mid abdomen? This is probably the most common spot for a mass effect you're ever going to see, especially in dogs. Okay, splenic masses are super common in dogs and cats. Okay, and so the spleen, we said the big part of the spleen in dogs lives right down in here, but the rest of the spleen kind of extends up this way. And so a mass effect in the especially mid ventral abdomen, most of the time is going to be arising from the spleen. Okay, but the pyloric region of the stomach probably extends down in there. The mesenteric lymph nodes, that again, we don't normally even see them on radiographs, but if they become abnormal and really big, they can cause a mass effect. The kidneys live up here, the ovaries live up here, the adrenal glands live up here. That would be a possibility, especially if the mass effect is dorsally located in the mid abdomen. Okay, and we can't rule out really the colon or the small bowel because both of those are going to pass kind of through that area. Okay, what about lateral view, caudal dorsal abdomen? What lives up in here? The big thing you're going to worry about up in here is just what we talked about. The sublumbar nodes tend to live right in here. If they get huge, they're going to push the colon ventrally. They're going to push the colon and small bowel and kidneys cranially if you get a mass effect from that area. So the sublumbar nodes are going to be a big likelihood that of something that could cause a mass from that effect from that area. The descending colon itself. So if you have something that lives in the colonic wall, that would be a possibility. Okay, the ureters pass through that area. It's pretty uncommon to get a ureteral neoplasm or mass of the ureter, but you could have an obstructive ureter that can become too big and kind of prominent. And then maybe the edge of the left kidney could also extend back in that area. Okay, so those would all be viable. And guess what? This is our next area we're going to worry about right here. What organs can get too big and cause a mass effect from the caudal ventral abdomen. Well, what lives there? Well, the big thing's the bladder. Okay. So the bladder, we said, can get really big on its own. A lot of times it doesn't mean anything other than you got to pee. But if the bladder gets huge just because you got to pee, it causes a mass effect. Okay. It's a physiologic mass effect because there's nothing wrong with it. You just have to pee. But if the bladder gets huge, it's going to push the colon dorsally. It's going to push all of the small bowel cranially away from it. Okay. Because now we have this huge mass effect coming from a distended urinary bladder and other things that live back there. If it's an intact male, especially the prostate will push the colon dorsally and can push the bladder cranially. Or if it's an intact female, the uterus and the cervix can live back in that same area as well. Okay, and then unfortunately, we're not going to spend much more time on this. You kind of get the idea now, I think, of this whole mass effect thing, but you have to do the same thing for the VD views. So right cranial abdomen, what could cause a mass effect on the VD view in that area? Well, the liver, the right side of the liver lives over there. The gallbladder lives over there. The pyloric region of the stomach lives over there. The right limb and body of the pancreas kind of live over there. So all of those things could cause a mass effect from that part of the abdomen. Left cranial abdomen, left side of the liver, fundic region of the stomach, the left limb of the pancreas kind of lives over there. Could probably include the left kidney and left adrenal gland in that same area. Okay. Mid abdomen, again, splenic mass is going to be the most common one, but it can be other things, anything that lives in that blue shaded area. So the adrenal glands, the ovaries, mesenteric nodes, pancreas, especially the right limb, the cecum lives right down in here, the transverse colon, the descending colon, but probably the most common one would be a spleen. And then the caudal abdomen, what lives there on the VD view? Well, all these things could cause a mass effect. The urinary bladder, the colon, the prostate, uterus, and the sublumbar nodes all live there. So I would expect that one of these blue diagrams you'll probably get on your test and to give you multiple choice options of you have a mass effect from a blue shaded area. What could it be? Okay, it could be arising from what? What's reasonable? Okay, so that's the concept of a mass effect. And then you have to realize that you can have a mass effect that can be caused, but it's not due to a specific organ. Okay, sometimes you can have so much fluid in the peritoneal space or a huge lipoma in the peritoneal space that can cause a mass effect. It's not arising from a specific organ, it's in the peritoneal space at all. Sometimes you can have normal organs that will cause a mass effect. Just like I said, the urinary bladder, if it gets huge and dilated just because you have to pee really bad, it can cause a mass effect. Okay, an abnormal fluid-filled uterus, usually that's going to be due to an infected uterus or a pyometra, that can get huge and cause a huge mass effect. So just because you have a mass effect, number one, people kind of get in the habit of thinking, oh, it's got a mass effect, it's an old dog, it's probably cancer. Well, it could be, but there's lots of other benign things that can cause a mass effect that's not cancer. Okay, then we're going to talk again about specific organs and pathologic things that can cause those organs to become too big or too little. And let's start back up again in the liver. Okay, what is the name for a small liver? The doctor word for a small liver, the real name, if you look up in a medical dictionary, is called microhepatia, which is the doctor name for a small liver. You will hear probably an incorrect name very commonly in veterinary medicine that somebody probably said this early on and it took off, but it's really not a word. It's called, people will say the dog has microhepatica, which is really not a word. The true term you should get used to saying is microhepatia. Okay, and what do you see with a small liver? Again, the liver does not extend out to the edge of the ribs. The stomach axis is probably cranially deviated. Some of the dogs are deep chested. They have really deep chested conformation like Great Danes and Dobermans and even miniature pinchers, a miniature Doberman, right? So they have deep chests. You know, Great Danes, Greyhounds would be another one. Golden Retrievers is another one. I used to have a Golden Retriever named Abby, and I would swear most of her liver lived in her chest next to her heart. She was so deep chested. Okay. So some of those dogs, just by their breed conformation, the liver looks like it's cranially deviated, and it's just because they have deep chested conformation. Okay. What are things, abnormal pathologic things that can cause a small liver? Well, there's not really a whole lot of them. If it's a young animal, the most common one is going to be a portosystemic shunt. It can cause a small liver. Another condition that's kind of similar to that, but the shunt vessels are small and microvascular inside the liver, is called hepatic microvascular dysplasia. Both of those in relatively young animals can cause the liver to become really, really small in its appearance. If it's an old dog, chronic liver disease, cirrhosis of the liver, okay? In people, obviously the origin of cirrhosis of the liver is probably going to be different than a dog. But if a dog has chronic exposure to some type of hepatotoxin over time, that can cause cirrhosis of the liver. Okay, so here's a crappy radiograph, but look at this stomach axis. Here's the stomach here. It's got food and gas in it. And the stomach axis now is cranially deviated. It should be perpendicular to the spine or parallel to the ribs. So it should be kind of in that axis right now, or in a normal dog. Right now, in this dog that has a small liver, it's cranially deviated. Okay, and look, here's the liver right in here. Here's the liver. That's a teeny liver, very small, kind of a sliver of a liver. Okay, does the liver extend well past here back to the edge of the rib, at the costochondral junction? No, it's teeny, and the stomach axis is cranially deviated. So that would be a good example of microhepatia. Okay, a big liver. The doctor word for a big liver is hepatomegaly. Okay, and there's lots of things that can cause a big liver. Some are neoplastic, some are benign. Okay, neoplastic things, the most common tumors that can live in dog livers are probably going to be lymphomas or adenocarcinomas or hemangiosarcomas, or all types of cancer that can occur and cause livers to become too big and then cause this mass effect. But there's also lots of benign things that can cause a mass effect in the liver to become enlarged, such as a hematoma or a hepatoma. A hepatoma is a benign growth in the liver. Okay, a big cyst. No matter where you see a cyst, cysts are almost always benign. Okay, and so, but you can have great big cysts that form in the liver that it can cause a mass effect. It can push on normal liver around it, but the cysts themselves are benign. Okay, big abscesses in the liver, nodular regeneration. We'll talk about a little bit more about nodular regeneration. We talk about ultrasounds, but nodular regeneration is a focal or cluster area of liver cells, hepatocytes, that decide we need to make new liver cells. And so it causes a focal nodule or a little mass that you can see in the liver, usually with ultrasound. And it's just a cluster of cells inside the liver that's making new liver cells. Okay, it doesn't mean anything other than the liver is doing its job. Okay, so what about this animal here? Okay, here's a lateral view. Here's the stomach. Okay, the stomach axis now is caudally deviated. This is part of the pyloric region of the stomach. So the stomach axis in this dog is caudally deviated because this huge liver, this is all liver. Okay, and it's causing caudal deviation of the stomach. So caudal deviation of the stomach axis. So again, this is the edge of the liver. It's still well defined. It's kind of multilobular looking here. But normally that liver should extend right here to the edge of the ribs. And in this case, extending far beyond the edge of the ribs. Okay. And then so he's got a mass effect in that cranial ventral abdomen caused by the liver. But then we got to figure out, well, what's some reasonable differentials that could be in the liver that's doing this? Here it is on the right side. Great big mass effect that's pushing this part of the pyloric region of the stomach caudally. Okay. Well, what's some reasonable differentials? Well, it depends on lots of things. It depends on, number one, the first thing I would want to know is how old is the dog? Okay. If he's middle-aged to older, there's a really good chance that's going to be some type of cancer in the liver. If the dog is young, then it could be a big cyst in the liver. Okay. If the dog has clinical signs of Cushing's disease and is PUPD, then it could be Cushing's disease that's causing the liver to become too big. Okay, so the etiology, a list of reasonable differentials of why the liver is too big is dependent on other things like the clinical signs, the history, the age of the animal, and you would re-rank those differentials based on that information. Okay, so again, causes of big liver, malignant disease, and benign things. We just talked about that. So what about this dog here? So I have a lateral view of the abdomen. Okay, surface serosal detail looks good. I can see the edges of the abdomen, edges of the margins, but here's the liver. The liver is huge. It's big, it's rounded. This is probably maybe a lipoma sitting next to it, but the edges of the liver right in here, it's rounded. It's a little multilobulated in appearance. The liver is big. It extends well beyond the edge of the ribs. The stomach axis here really isn't much caudally deviated, but it's very minimally distended with gas. But the liver is obviously too big. Okay, so this is a dog that your reasonable differentials could be hepatic neoplasia. This dog had Cushing's disease, so that's causing the liver to become too big and enlarged. Okay, what about this dog here? Do you think his liver is normal? Well, look at the stomach. Here's the stomach. This is the pyloric regis stomach, and it's severely caudally deviated. That stomach axis is severely caudally deviated, secondary to this great big mass effect that's arising from the liver. Okay, so as the liver gets bigger and bigger and bigger, it's going to push everything away from it. Okay, so again, what's reasonable differentials? Again, first thing I want to know, how old is the dog? Because that ranks, it's going to make a difference. And if you're going to put neoplasia, some type of cancer, highest on your differential list. And so if this dog is 10, there's a really good likelihood this is going to be due to some type of neoplastic condition in the liver. Okay, again, the mass effect. Look at this big old right side of the liver way over here. So it's huge, this big mass effect. Everything's being pushed away from it. Okay, hepatic gas, every now and then you'll actually see gas inside the liver. I don't think I have a slide of that, but you'll see gas in the liver, and almost always that's, again, it's the same thing about gas in the peritoneal space. The gas has to come from the outside or it has to come from the inside. And so sometimes when you see hepatic gas, you'll see it from gas-forming bacteria due to abscesses in the liver, or ascending gas into the liver that comes from an infection of the gallbladder itself. Okay. Sometimes you'll actually see mineralization in the liver, and this is an example of that. So here is the liver. This is a kitty cat. This is liver right in here. This gallbladder is sitting kind of in a weird spot on the lateral view, but that's sand-like calculi in the gallbladder. And these little areas of linear mineralization, this is a blow-up view of it here. So these little areas of linear mineralization are stones, small sand-like stones that are actually in the intrahepatic bile ducts inside the liver. Okay, so these really aren't in the liver, they're in the intrahepatic bile ducts. So this is a good, we'll leave this for today. This is a really good party word, this second one in here. So that's a good happy hour party word for discussions when you're talking around your other colleagues, right? So the doctor word for stones inside the gallbladder is choleliths or cholelithiasis. And these areas of mineralization that are inside the intrahepatic bile ducts, those are called choledocholiths. It's kind of fancy, right? So this cat here has choleliths and choledocholiths that are stones inside the liver. Okay, sequela to hepatic disease. So now we said we have things that can cause small livers. We can more commonly things that can cause huge, big livers, push things away from it, cause mass effects. But anytime I have disease in the liver, we can see things that happen as a sequela to the liver having issues, right? And so we know the most common thing we're going to see when the liver has issues and becomes too big is a lot of times it will cause fluid to form in the peritoneal space. And again, how much fluid should a normal dog or cat or person have in their peritoneal space? The answer is always the same, just a few drops. Okay. If you have accumulation of fluid in the peritoneal space, that is abnormal. If you have disease in the liver, very commonly that will cause peritoneal effusion. Okay. A pure transudate in the peritoneal space is water-like, very thin, non-cellular fluid that forms in the peritoneal space. And you can see that sometimes in dogs that have right heart disease that get ascites and hepatomegaly just due to right heart disease and dilatation of the vessels inside the liver. Okay. You can also get a modified transudate fluid accumulation that forms in the peritoneal space. Sometimes you'll also see that with right heart disease, but sometimes you'll see that with infiltrative disease of the liver, including certain types of neoplasia. Okay. And you can also get a hemoabdomen. So you get hemorrhage or frank blood in the peritoneal space. And a lot of times you'll see this related to hepatic disease where you may have a ruptured mass in the liver that now you're bleeding internally into the peritoneal space. The other thing that big livers will commonly cause as a sequela is vomiting. The liver gets so big, it compresses the stomach. So every time the dog or cat eats, there's no really room for the food to go, and they vomit it right back up. Okay, let's stop here. We're going to pick up on spleen tomorrow. Same time, same channel. All right. So everybody have a good rest of your day, I hope. And I will see you tomorrow morning, and we'll continue on with this slide. Cool beans?
Sir, thank you.
All right. See you tomorrow. Bye.